My name is Richard Welbourn. I'm a consultant upper GI and laparoscopic surgeon. I work in Musgrove Park Hospital in Taunton in Somerset, and also in the Taunton Nuffield Hospital, also in Taunton. I'm going to talk a little bit about inguinal hernia surgery. We see a lot of usually older people, often men, who find lumps in their groin, and this turns out to be a hernia. And hernias can cause a lot of disability, pain, inability to conduct your normal activities. And if they get really big, they can actually cause strangulation of the bowel, which can be a serious complication and require urgent surgery. So we try to avoid this if possible. And most hernias will need repairing. And the way we do this usually is laparoscopic surgery, that is minimally invasive surgery through usually 2 or 3 small incisions that heal very quickly. Now, the advantage of laparoscopic surgery is that patients recover quickly from the surgery. There is very little pain after surgery compared to an open operation where there is a big incision, and the return to normal activity is much quicker in general with laparoscopic surgery than with open surgery. So typically patients will come in, they'll want to have the hernia repaired, they come in on the day of surgery, they have the operation, they go home the same day. We put lots of local anaesthetic into the wounds, that does wear off, but usually patients will be able to go home the same day by getting up and moving around, and they'll be back to normal activity within a few days and fully recovered by about 2 weeks. So we don't use stitches, we use glue for the skin, so patients don't need to have stitches removed. Patients normally come back and see us at about 6 weeks to make sure everything is okay, but function should be restored within a few days, and usually it's a fairly painless recovery from the operation. So other sorts of hernia we can treat are femoral hernias. These are typically in older ladies. They're fixed with this, they're repaired by the same operation. We use meshes to repair the hernias, and the meshes go on the inside of the muscle, so there's no cutting through muscle or nerves, which can cause problems afterwards. Other hernias we treat are hiatus hernias, and these are typically causing reflux symptoms with acid coming up and causing horrible, unpleasant problems at night time with acid coming up and burning and causing unpleasant symptoms. So these can also be repaired by keyhole surgery, and typically patients will also come in on the day of the operation and then go home within 24 hours. And recovery is similar to inguinal hernia surgery. That is, patients are back to being normal by about 2 weeks after surgery. This can also be life-changing because the reflux will stop after surgery and patients feel much better after the operation. Come and talk to us about the operations. We're happy to go through them with you and talk about the pros and cons in your individual case.